Let's talk about what is happening at the COVID inquiry, because we heard from Helen McNamara yesterday, who was the senior civil servant, who was pretty damning about the culture in Number 10. Today we've heard more, I should say, as well, over the course of the week, from Lee Kane, who was the Director of Communications under Boris Johnson at Number 10, Dominic Cummings as well, firing quite a few broadsides. He's continued that on Twitter and his Substack as well. Also, we're hearing today from Simon Stevens, Sir Simon Stevens, who was the head of the NHS. Now, he has said some pretty incendiary things as well. He's quite a mild-mannered person. But what he's saying really about Matt Hancock, there seem to be quite a lot of people criticising him, the former health secretary, of course. Simon Stevens has alleged that Mr Hancock wanted to decide personally if the NHS was going to be overwhelmed, who lived and who died, essentially where services should go. But surely the point of them creating NHS England was that it was to be operationally independent. This is what Sir Simon Stevens told the inquiry today. This is an exchange with one of the barristers, the King's Counsel, that is leading this, a man called Hugo Keith. This is what happened earlier on.
The Secretary of State, that's Mr Hancock, took the position that in this situation he, rather than, say, the medical profession or the public, should ultimately decide who should live and who should die. And then you say, fortunately, of course, that dilemma never actually crystallised. But Jeremy Hunt had taken a different view of this matter, had he not. I think it was connected to exercise sickness, which had happened some years before. He had taken the view, and this is in fact something that he spoke about in evidence in Module 1 of this inquiry, that decisions of this type ought to be reserved to clinical staff.
I thought it would be highly undesirable, other than in the most extreme circumstances, and you can argue that these are the most extreme circumstances, and that is one of the reasons why the Department of Health and Social Care, I think, created a ethical and moral advisory panel to sort of ask the question, you know, if absolute disaster strikes, then how would you ration care, limit it in a way that would be fairest?
I don't think those decisions should be anything to do with politicians. I think that should be down to clinicians. Let's get the perspective now of Michael Jacobs, who's a former advisor to the Chancellor and Prime Minister Gordon Brown. He worked at 10 Downing Street. Michael, thank you for joining us. Really appreciate it. I mean, what is your take on this, really, the last few days, but particularly what Sir Simon Stevens was saying there? Because we've heard from Helen McNamara yesterday, the senior civil servant, about Matt Hancock. She said there were nuclear levels of self-confidence within Number 10. Now, you've worked in Number 10. You know that you need to be someone who's not backwards and coming forwards to get your point across. But really, there's a difference between confidence and arrogance?
And the main thing that we've heard about Matt Hancock that I think is extremely alarming is that he wasn't telling the truth. And we've now had this from a number of witnesses, that he used to go into cabinet meetings and meetings of the COVID team and say things were happening and they weren't happening. Helen McNamara's evidence yesterday was really damning about this, and Dominic Cummings before her, that Matt Hancock simply wasn't speaking the truth in those internal meetings, quite apart from what he was saying to the public, which wasn't true either. But even in the internal meetings, he was claiming things were under control when they weren't, that there were plans when there weren't, and so on. And this is a really damning indictment of a minister. It
really is. And it's interesting, I'm sure Mr Hancock would defend himself and would deny that he was lying in any way. But there's also evidence put forward by Simon Stevens today saying that junior ministers were sent to meetings that Matt Hancock attended because other secretaries of state, this is the more senior level obviously, and then the junior ministers beneath them, the junior ministers were sort of sent because people didn't want to be in meetings with Matt Hancock because they didn't believe he would tell the truth. I mean, that is pretty damning stuff.
It's extremely damning, and I can't recall ever hearing anything like that. Certainly when I was in Number 10, nothing like that would be, I can remember it, and nothing like that. I mean, you know, there are differences of opinion between people, but the idea that a minister wouldn't tell the truth about an absolutely vital activity that was going on in the Department of Health, trying to cope with this pandemic particularly in those early months, is absolutely extraordinary. And, you know, the fact that people were saying they didn't want to be in meetings with him because they didn't trust him and so on, it is. I mean, he will no doubt out have his say, and so we will have to hear from him. But this has now come from several sources, so at the moment we must take this to be likely to be true.
Now, Matt Hancock has given evidence to the inquiry already. He will continue to do so because there are 5 separate bits of it, 5 modules they call it. But I just wonder, are we focusing too much on the personalities here? Are we, as the media, as a public discussing this, are we thinking too much about, well, this person didn't like that person and this person's trying to pull the rug from the other person before they give their evidence and so on? In terms of the substance of this, when Heather Hallett gets to the end of these inquiries, and you've certainly, Michael, had, I know, as many as, I don't mean you personally, but Labour in general have had inquiries into what they've done previously. I mean, do we actually get to the bottom of this, really? Do we really know what happened and what could have been done better when actually some of this is, I think anyway, and you may disagree, just personal mudslinging and trying to cover their behinds in terms of the report coming out on this?
So I think it's inevitable that when you have people like Dominic Cummings giving evidence, and Lee Kane, the former press officer, and being, revealing not just that they criticised things at the time, but that they were using really foul language and so on. It's inevitable that the media will pick up on that and will focus on the personalities. In the media, that is one thing. I don't think this will affect the quality of the final report. The final report is gathering the evidence on what happened, and all of this is part of the evidence. And there's lots of days when you won't feature it in your programmes because it doesn't feature the famous personalities, but it's all going in. And I do trust Lady Hallett and her team to compile all that evidence and to produce a report which says, most of all, how we can avoid government ever getting into such a chaotic state again, and how we can be prepared for future pandemics and so on. And that ultimately is the point. It isn't to bring up what was going on in Number 10 between different personalities. That's, in a sense, a byproduct of the serious initiative, which I have every confidence in Lady Hallett to conduct. Unfortunately, we've also got this additional set of revelations about Number 10, about Boris Johnson, who we knew it already. He was unfit to be Prime Minister. He was not a competent person, who didn't treat the job seriously, was frequently not there, and that we've had some damning evidence about that. But also some of the advisors and some of the ministers who clearly were out of their depth and really should not have been in those positions. And I think it's a general lesson to the Conservative Party, which elected Boris Johnson, and to the public, to all of us, because we also elected Boris Johnson to be Prime Minister in 2019, and we allow the Prime Minister to appoint anybody he wants to be a special advisor. And unfortunately, the civil service also has to answer, because there were some people at the top of the civil service who allowed things to happen who shouldn't have done.
At various points of the civil service as well, and this sort of machine that wasn't working as well. I mean, I agree with every word you've just said in that last answer, but there were many parts of the machine that just didn't work. Michael, just briefly before you go, I hope you don't mind me asking you about the economic news today, the hold on the interest rate at 5.25%. We're looking at sort of flatlining to 2025 perhaps. What do you make of this decision and the political reaction to it, just briefly, if you would?
Well, nobody is surprised that interest rates have been held. The UK economy is now teetering on the verge of recession, and the Bank of England clearly didn't want to push it over the edge by raising interest rates at this point. Effectively, the bank is not really working on affecting inflation very much. That's happening outside the bank's action. So the bank's job mainly is to keep looking as if it's bearing down on inflation, but let inflation come down, which it will do in due course. And so what it really didn't want to do was to push the economy into recession. Many, many people are still yet to feel the real effects of this. We've got higher prices, everybody can feel them, but as tens of thousands of people every month come off those fixed rate mortgages onto the new interest rates, that is really going to hurt. And that's why the UK economy is in so much trouble. People can't spend money. Could well be a huge challenge for perhaps the next Chancellor, or perhaps the first female Chancellor, Rachel Reeves. We'll talk about that some other time, Michael, but thank you very much indeed for your contribution there. Michael Jacobs there, former advisor to Gordon Brown, both when he was Chancellor and in Number 10 as well.